So I'm sorry I'm delayed. I haven't had a radio interview since May. You know, I was interviewed 2 or 3 times where they were saying, oh, this is dangerous what you're saying. And then I just had one this morning. It was supposed to be yesterday, so that's why I'm a little late. And it was in Cork. And he kept using words like conspiracy, and I didn't go there at all. So I suppose there's very good news. Can you hear me? Oh, I'm sorry. Okay, there's very good news. The good news is that coronaviruses circulate 4 years out of every 10 years. So all of us, so 40% of the flus are coronaviruses, 30% of the common cold is coronaviruses. So what people are not taught, and the doctors are not taught, is that you have an immune system. And how you know you have, if you remember when you had chickenpox, you would get chickenpox and you might be unwell and have spots or whatever for a week or 2 weeks. But what that is why you suddenly get better and then you are immune for chickenpox for your life, is that your immune system recognizes the virus and it kicks in, you feel unwell. And why you feel unwell is that to get rid of the virus, your body has to raise your temperature. And that raising of the temperature makes you feel exhausted. And it makes you slow down, lie down, sleep. So it gives the energy of the immune system to defeat the virus, clear it, and then within 2 weeks or so, you'll recover. And you'll be fine, and your immune system, if you come across chickenpox again, will remember it, and you won't get the symptoms, okay? And you'll be fine. So what happens with coronaviruses is it's a virus that causes the flu, so 4 out of 10 years. They circulate the globe, and people come across coronaviruses, every second year, and between 85 to 98% of people, no matter what age you are, won't have any symptoms. Because your immune system will recognize 1 or 2 viruses, will kick it out even when it's on the surface. So the virus won't get in your body, you won't even make an antibody, you won't even have symptoms. So someone like that, which is between 85% and 98% of the population, will be negative on all these tests because the virus didn't get into their body, they didn't make antibodies. But the main thing is the whole population see these viruses every winter, every single person on the planet. And after 3 or 4 weeks in a region, everyone will have either have had no symptoms, 9 out of 10, or the people who get illness are usually the people that make the antibodies, the 1 in 50 or the 1 in 10. And they will have antibodies, they might have had flu symptoms, and they'll be well. So what we have is we have an immune system. So this year we had influenza B circulating in December 2019. We had influenza A over Christmas, and we had coronavirus around January, February, March. Okay? So you might have remembered, I actually got all 3 of them. Okay? I got all 3 of flus. You might remember being sick before Christmas in January. I certainly was. And the symptoms of it, which wasn't spoken about at the time, were like you had flu-like symptoms. So I would be the 1 in 10, we'll say, people who actually got symptoms. And I was stressed because I was standing for election and trying to work and pushing back on all this stuff. So I got symptoms. So you would be a little bit breathless. You had a cough. But these symptoms happen over with flu it comes on quite quickly, as you know. And then if you don't recover and you get breathless, that whole process takes a week, So the good news is, though, that, and if I had known, and that's why I came out, and this is important for other flu seasons, whether it's influenza virus or coronavirus, is that if you have good nutrition and you drink water and you sleep, you will actually help your immune system to attack the flu virus, right? That's common sense. But if you have poor nutrition, so the most important thing is nutrition, but then you can supplement with vitamin D, C, and zinc, okay? So then if you do that over the winter season, especially zinc, that actually helps the immune system get rid of the virus. If you don't have zinc, your immune system doesn't work very well. But then there are other treatments like inhaled steroids. And what they do is they just help your immune system attack it. So the treatments like vitamin D, C, and zinc, your own immune system will clear it. So you will have built up an immune response. And the beauty of that is when you see the coronavirus again, your immune system is boosted, so you'll have less symptoms, And so what they are acting as if we don't have an immune system. And what I'm saying is use it like the analogy of chickenpox, right? Where you get sick for a few weeks and you're essentially immune for life. And so each time there's a circulating coronavirus, your immune system is very quickly going, oh, that's a coronavirus. It kicks in, you may not have any symptoms, you have flu-like symptoms, and you're well. But the most important thing is for coronaviruses, which I'm saying these guys have picked the wrong virus to launch a pandemic, right? The same as carbon dioxide is the wrong molecule to do all this global warming thing. They didn't actually know the chemistry of it. So in coronavirus, it's seasonal, right? So the main impact of it is just between December and April. But in every region, people build immunity in about 6 weeks. You know, so in China, it was actually, we say it started December, January, February, but Nobel Prize winner Michael Levitt said on the 28th of January 2020 that there would be a precipitous drop. The peak in China would be in February, and there would be no deaths in China from the 18th of March. He forecast that, right, looking at the data as a Nobel Prize winner, and he was exactly right. There was no deaths in China. The peak was in February. So that's to tell you these ones are seasonal. And why? And so in Ireland it came, you know, February, March. And when I did my Dave Cullen interview, if anybody saw it, there was a graph with 3 little peaks. And so one was a precipitous drop. But the first peak was influenza B in December. Second peak, influenza A. The third peak was COVID-19. But that's to remind you that flu is seasonal. And within a month in December, it meant that in the whole world, everybody got the flu, you know. It actually goes the way the earth circulates, China, Europe, America. And each region will have, everyone will get it within about 5 weeks. But what they're not telling you is, why is no one sick after 5 weeks of influenza A in December? Is everyone has built immunity. So if you're still alive in January, every single person in the world has developed an immune response to influenza A, and we're all well. So what they're doing now is like if I set up a company, which I said on the radio station, and I started getting millions from the government to test people for influenza A. Now, right? We had it all. It was a flu in December. Everyone had it in the world. And if people who were dying of Alzheimer's, that I was testing them for influenza A, and the doctors were reporting the deaths, like everyone in Ireland would have come across it, about 1 in 10 would have made antibodies. 1 in 10 or 1 in 50 might be PCR positive, the rest aren't. And I started reporting cases of influenza A, a flu in December, that everyone had and everyone recovered from. And there's now this big media storm reporting cases of influenza A, when actually, guys, it was a flu, a winter flu. It peaked in December. It's gone now. We're all immune. So they are doing the exact same thing for COVID-19. It's a seasonal coronavirus. About 1 in 10 people had the symptoms. We're all immune. So they are now testing people who had it, were exposed to it, and they just have fragments of the RNA. But the testing, which we don't need to go into, may actually be positive if you have a common cold, you know, or another circulating virus. Just because they've had this media storm, like the way we had 2 influenzas, there could be another circulating coronavirus. So all the testing and cases, it's over. It's really a flu. And so I knew in March, so you can search if you want to write down, the World Health Organization, the 11th of March 2020, when the Director General announced the pandemic. I knew straight away, you can read the second line, straight away I knew, he said, it had already gone to 114 countries. That means these viruses circulate the world, right? The governments are not going to stop them. People travel on airplanes, right? In the 11th of March, it had gone to 114 countries. That's just where they tested it. It had obviously gone in the whole world. But the number of deaths in December, January, February, March, when they declared the pandemic, in the whole world, 7,000 million people, was 4,291. So you had a chance of dying from COVID-19 of 1 in 1.8 million. Right. So you have a chance like the people, so 56 people were dying every day of COVID-19. So every day in the world, 3,000 people die of TB. Every day. So in the whole world, in 4 months, it was the equivalent of 1 day. TB is an infectious disease, right? So you had a chance of 1 in 1.8 million of dying, whereas 1 in 3 people die of cancer, right, in every family, right? 1 in 3 people. So that it actually, there was no reason to call a pandemic. And it turns out in SARS, the previous one, so how do you know as well, like, should this be a pandemic? So the famous SARS, if you remember, SARS, in 2002, 2003, which they were, flagging as a pandemic. In the whole world, there were 6 billion people at the time, 6,000 million people. In the whole world, guess how many people? I know it's hard to guess, but obviously all deaths are tragic as well. I'm not undermining. 150,000 people die every day. But in the whole season in 2002, 2003, 774 people died in the whole world from SARS. So you had a chance of dying back then of 1 in 1.8 million people, right? This is not, 700 people died. That's like a few hours of one day of TB. The World Health Organization is calling, and that's all on the World Health Organization website, the 774 people. There was one person that died in Ireland back then, one, okay? This is not so, so it's not, these coronaviruses are rare. They're not something to close down the world for. They are not infectious diseases. And if you were going to close it down, there's like 50 times more people die of the infectious disease, just TB every day. 20 more people die of other kind of infectious flu-like symptoms every day. So there was no reason to do it. But the really good news is we have treatments. So it turns out that vitamin D can actually prevent about 85% of the deaths now if you get high dose vitamin C, vitamin D, okay? So say next winter, if you have a bad flu, you can actually ask your doctor to get higher doses of vitamins C and D that will protect you. But there's also, you can ask for inhaled steroids, which are well proven. There's also some interferon, but of course there is the drug hydroxychloroquine, right? And hydroxychloroquine only works with zinc. It is a zinc ionophore, so it helps zinc work. So if you take zinc as a preventative dose, you're actually giving your immune system the building blocks. Because in the end of the day, no matter whether you get hydroxychloroquine or not, it's your own immune system actually provides the protective response. And in these viruses, you actually clear the virus, it's called, so that the virus particle, when your immune system works, the virus particle is gone and you're well. So the good news about hydroxychloroquine is it's on the World Health Organization Essential Medicines of the World. It's been approved 70 years ago. It's used in Africa for malaria. It's called the Sunday drug. It can be given to breastfeeding women, and pregnant women, and it can be given to children. And it works very well for malaria and for autoimmune diseases like lupus and arthritis. And it was previously known to work for coronavirus, and it was shown in China to work for coronavirus. So it's one of this. It works for arthritis and lupus. So what was shocking then in January or so is that that it was well known, it was working. And in some countries like France, it was in the newspapers, they gave it to a lot of politicians and the doctors, and then they destroyed the stockpile of hydroxychloroquine. And then in Ireland, they came out and said that doctors couldn't prescribe it. You can prescribe hydroxychloroquine for lupus arthritis the whole time. And then later on, in around May, the FDA said to doctors that they could be struck off if they prescribed hydroxychloroquine, one of the safest drugs in the world. So they could prescribe it still for lupus arthritis, but not for coronavirus, right? And of course, the American Association of Physicians and Surgeons on the 6th of June 2020 are taking a legal case against the FDA because this is the first time ever that a licensed drug for 70 years, one of the safest drugs as well, right? They monitor, has been withdrawn in the middle of a so-called pandemic for treating people. So I'm not sure whether it's allowed in the UK. So a lot of the time, I know in Ireland, you can prescribe it in Ireland for like arthritis and lupus, but there was a kind of a guidance from the manufacturing to say they weren't sure if it was safe, even though it had been published. And then what is undermining and why people like me are speaking out, this process is undermining the governments, right? Because if you have a treatment, so the combination of nutrition, vitamins and zinc, and things inhaled steroids, interferon, hydroxychloroquine, if you have a treatment and they were given to people who have the symptoms, 99.9% of people will not die, okay? So of course, if you have something then that probably the death as of now, without treatment in Ireland, we now have 100 verified deaths from COVID in all of 2020. But if they had got treatment, probably all of them would have lived, right? So then that has two questions, and everybody knows this. The publications were known 2003, 2005. It worked in China in January and February. So the doctors, but not what they were not doing was telling people about prevention and food and vitamins, but they were destroying hydroxychloroquine in some countries, and they were saying it used to be available, now it's not available. And then they were doing this lockdown for something that was not necessary. So the politicians and the medical advisors are hyping up something that is unnecessary if they made the treatments available, including prevention by food and vitamins. So it was known to be very rare, right? When they call the pandemic, the chance of dying is 1 in 1.8 million. So that's very rare. 1 in 3 people die of cardiovascular disease in Ireland, 1 in 3 of cancer, 1 in 3. So this is like a very rare, you'd have to be 60 years in Ireland on average when the pandemic called for one person to die. There was no basis on the data available to do the lockdown. But the good news is hydroxychloroquine, you can also do it as a preventative dose, 1 tablet a month from October to May. And it seems to also prevent symptoms of other flus like influenza. But of course, the most important thing is if you take vitamins and zinc. So it means less people may potentially die now because people are aware that they, can actually boost their immune system. So then the other thing then I was doing when I was speaking out, I was asking for people to help me in Ireland. And I'm saying globally from the beginning that Ireland could actually change this whole thing in the world, right? Because when it's such a small country, when people die, we all know each other, right? So what I was saying is that if there is a treatment available, if the government, they are still reporting over 1,700 deaths from COVID-19, but if there's a treatment available, that we should be looking at all those deaths and asking the doctors, did you give them treatment? Okay? So that means it's preventable, right? So we were then, with not me, but with a group of people, were writing. Well, I was saying it that people are writing. So it wasn't me, but they were liaising with me. And they were writing to the doctors, because you can look up at rip.ie and write to the coroner. So we knew which regions or which shires or counties in Ireland had the most deaths. And we were writing to doctors and the coroners, because they're public officials, to say, you have reported, 500 deaths in Dublin or Kildare. Can you, just reminding them that coroners have a duty, it's a legal process to write the correct cause of death. So if someone had terminal cancer or died of Alzheimer's, then obviously that should be the cause of death. And if they, not. So and the same with doctors, we were just reminding them that it's a legal process and they can potentially be struck off, right? And we were publicly available saying it, so that you could actually go through each of the 1,700 deaths and look and see what happened. So the good news is, on the 9th of September 2020, you can look up cso.ie, search vital statistics, Q1 2020, and you'll see, now I'm going to be publishing, I've written a report for it, but they have now said the number of deaths in Ireland, because we've been, making it known that the number for 1,700 was exaggerated and that doctors and coroners cannot be incorrectly ascribing. And hundreds of people contacted me and said, my elderly relative died of Alzheimer's, but on the death cert it says COVID-19. So we have already hundreds of people in Ireland that were willing to do a public inquiry and go through each of those deaths. But on the 9th of September 2020, CSO, Vital Statistics Q1, the number of deaths now that died of COVID-19 in December, January, February, March in Ireland is 0. Yeah, just because, so the first death was in April, right? That meant no death. Now, I've been emailing as well and they confirmed it. But even though it's reported on the website 1,778, right, on Euromomo and Our World in Data, they now came out and said the number of people, so, it's like testing for the chickenpox or influenza A. All these big numbers that are positive on a COVID-19 test is just that they had influenza, they could have died of something else. So in the CSO, and it's called the HSPC, the Health Surveillance Unit, have come out and said in a table the number of people in Ireland, all 2020, that died of COVID-19 now is 100 in the whole country. 100 But of course, what we will be doing now, that only came out last week, is looking up each of those 100 deaths because they were preventable deaths. And if they happened after April, the Zelenko protocol, the Raoul in France were publishing that it was widely available that hydroxychloroquine worked. So those 100 deaths again. So we will be pushing back for the next one. They don't officially do the breakdown of those until November, but we will be making it known. We will be assessing each of those 100 deaths for the doctors, because if a coroner, actually one of those 100 was not COVID-19. Because of course, if the numbers are low, it doesn't justify the lockdown. And it doesn't justify the elderly being isolated, which there's no need for. And if there is a treatment available, they can be fine. Yeah. But the thing is, because these viruses have similar about the region of, I think it's 1 in 500,000, in Ireland under 65, and then it's obviously 92 per million. But if you have a treatment, those deaths are preventable, and the treatments are really effective. So therefore, the good news is there's no real scientific or medical basis for the lockdown. But for the next winter season, which is I think the pharmaceutical industry really don't want, is that hydroxychloroquine and zinc work for any flu immediately, right? So you don't need to wait a year for a vaccine. There's no panic. And it also seems to work for influenza, right, virus, so that you can take a preventative dose of 100 milligram tablet if you're over 65 or you feel you have underlying conditions. And it costs 10 cents to make, and you can usually get it for about 50 cents. It's very cheap. So you then, for other future things, and of course then you don't need to take a vaccine because you've got a safe and effective treatment. But hydroxychloroquine works within 3 hours to 8 hours. So if you didn't want to take the preventative dose once a month, you could just say, well, if I'm, because only maybe 2 in 100 people get symptoms. So if you never get flu symptoms, you don't need to worry. You don't need to be taking anything. Your immune system is actually boosted. But if you are the 1 in 10 or 1 in 50 that do get flu, then you can just have hydroxychloroquine available to you, or ask your doctor, will you prescribe hydroxychloroquine if I need it? And within 3 hours, the symptoms will be reduced. And what I'm saying to people is, if you don't have symptoms and you don't go to hospital, you won't die, right? You don't need to be PCR testing. This is a flu, and the symptoms are, and then there are, which I won't go into, if you have coronavirus contamination from dog kidney in an influenza vaccine, which happened in 2018 in America, and some of those influenza vaccines, if they have this dog kidney with coronavirus, that if the next circulating coronavirus comes, that of the American military, when they tested it, 1 in 3 of and people actually die of sepsis-like symptoms. They don't die of influenza, and you can die very quickly. It's sepsis, so you can die very quickly. So why I came out in May, because the Irish Medical Organization in 5th of May said they were recommending as some kind of a treatment for coronavirus that the total population of Ireland would get a flu vaccine, which had been known to have an issue with coronaviruses, with viral interference, but that year's one that was tested in the US Army 2017-2018, normally they're made on chicken eggs, were made with dog kidney, which has coronaviruses. And you get this viral interference, or it's called immune system priming or super priming. And it's known that if you come across a virus like that, that anyone, no matter what age you are, when the next circulating similar virus comes, 1 in 3 people or more can have serious consequences, and can, like in the animal studies, the animals would all seriously ill or died, right? So that's why there has never been an RNA vaccine, because in the animal studies, when they tested it on the ferrets and the animals, they were fine, but then when they exposed them to coronavirus, they all died. So of course the Irish Medicines Organization recommending a potentially corona contaminated or part of influenza in the middle of a corona outbreak, where they had locked people in their homes and they were going to release the lockdown, because the vaccine, after 2 weeks, your immune system would be primed. And I was saying that if you do that, the people, when they came out, would all start dying or be very sick, and that would be called the second spike. So I was calling it out when people were locked down, because they would be dying of sepsis. And it would be like nurses and people who had got the, police. And so that if that was happening, that was not a random event, that it's well published, this viral interference priming, and that it would be immoral to be recommending a potentially, influenza vaccine for corona when this viral interference is potentially 1 in 3 people for an illness that was not, was very rare, that would not kill anyone. So I can just give you, there is no need for the lockdown. There's no need for teenagers and people to be wearing masks. And if you do wear a mask, you will have you'll have anxiety, for teenagers. There's huge increases, there will be, in suicides. And there will be increases in diseases like pleurisy and pneumonia and chronic fatigue. But the worst thing is, and it makes sense, this is all common sense. When you have a mask on, you're rebreathing your air, so you don't clear your carbon dioxide. So you have very quickly, in America, 2,000 parts per million is the safe dose. Above you can't work. But when you wear a mask, it goes up to 8,000, which is essentially, parts per million. It's like 20, 30, 40 times. You get headaches, you get chronic fatigue. It's like working in a dangerous environment. You're not supposed to work in 2,000 if you were working in a room. And wearing the mask is the equivalent of working in a toxic carbon dioxide, and you have less oxygen. It suppresses your immune system. It also activates any latent viruses you have, so that you will be more sick for the next flu season, as well as, 90% of communication is non-verbal. So you have, loneliness and anxiety, and it actually subconsciously makes you stressed when you can't see people's expression, because your subconscious part of your brain doesn't really know what basis, whether they're, friendly or not. You can't actually read the clues. So there's no need for lockdown, there's no need for not having churches, there's no need for social distancing, and it can all be on overnight. So Thank you very much. Yes. Any questions now? So in Ireland, the manufacturers. Oh yeah, you can. I mean, it's quinine. Yeah. So I don't know. So do you have any questions? Yeah. Well, I'll just do briefly because I don't have that much time. So Dolores Cahill, my degree is in molecular biology, and my PhD is in immunology, and I worked in the Max Planck for 8 years, and I developed and patented a small chip technology that was quite innovative at the time to help diagnose when you took a small amount of blood, autoimmune diseases and also cancer, and we were diagnosing people early so that with autoimmune diseases you could make lifestyle changes, including nutrition, to reduce the symptoms. So even though you were diagnosed with the disease, you could have a full life, and you didn't advance to such a stage that you required pharmaceutical intervention. So, and also I've been advising governments on a voluntary basis for 10 years on the Government Advisory Science Council to just bring a little bit of common sense. But I would be aware how governments work and how money is spent, so I would be trying to get the best value for money. And I've been an advisor to the European Union and multiple countries as well. And I was vice chair of the Innovative Medicines Initiative that gave out 1,000 million, which is with the pharmaceutical industry, but they asked me to resign. But I still haven't resigned because we're in discussions. They have to show that what I said was incorrect. So that's my experience. And I also had a company that I set up between 1997 and 2019 that actually commercializes this thing. But I do have to say one important aspect is there were two, these famous clinical trials and papers. So I think what COVID-19 is undermining the bond we have with our doctors and nurses and the medical profession and the media and the TV and the politicians, but especially the science community, because those journals, or Lancet and the New England Journal of Medicine, in those papers they gave hydroxychloroquine. It works when it's early on in symptoms, but in the clinical trial they gave it in some of those trials when the patients were already in intensive care with a day to live, with having very severe symptoms. So hydroxychloroquine can't work, and in some of the studies they were giving them 8 times the dose, between 4 and 8 times the dose, on 3 or 4 days, whereas hydroxychloroquine has a half-life of 21 days, and it's effective at a certain dose. But of course, in medicine, the dose is important. So it turns out the dose was the lethal doses. So they were giving them cumulatively the lethal dose, and people died. So the thing is, I spotted that. So when I did my interview, people were saying, because they were published, that's when the FDA, they used that in countries to withdraw hydroxychloroquine and say it was dangerous because people were dying of hydroxychloroquine, but they were giving the hydroxychloroquine within, when people were already dying, when that's not how it works. It'd be like giving, antibiotics for someone with pneumonia, but waiting for weeks and then giving them the antibiotic just before they're about to die and say the antibiotic doesn't work. So when I came out on the 11th of May, I was saying this is wrong, right, before the papers were retracted, that hydroxychloroquine is one of the safest drugs. And so when I've been interviewed on the radio, they were saying, well, look, in these clinical trials in the Lancet New England Journal of Medicine, I'm wrong, they are so reputable. But of course, those papers had to be retracted because they were wrong. And in some countries in South America, they are arresting the people who gave those injections and the ethicists and the scientists, because you cannot be designing a clinical trial and giving people a lethal dose. I mean, who would go on a clinical trial? So this whole so what they had to do, if you were to be cynical about it, was to have hydroxychloroquine not be a treatment to justify a lot of the societal measures that have gone on. But those papers are now retracted. It has undermined science. And hydroxychloroquine, in people's mind, they now associate hydroxychloroquine with a dangerous drug, but it was not true. It's still one of the safest ones. So I think there is a bond, we as scientists and doctors and politicians and the media are supposed to have data behind what we say. And the governments all around the world are saying we need lockdown and this is dangerous, but based on, not providing information that there were treatments, and based on testing, which is not relevant, and not comparing the harm of what's going on.
The governments are owned by the bankers.
Well, we won't go. Yeah, you have a question? Yeah.
Well, I was going to ask whether you have a theory on who's doing this.
So no, I think what the thing is that while I've been researching this for 17 years, I'm just saying that the medical, the data does not support the masks and the lockdown. So, someone else can stand up and whatever, but I don't, the way I have huge knowledge about what's going on, but I'm happy to answer any other questions. Yeah.
The situation in Sweden, you're saying that there are very few. One thing that occurred to me is that Sweden had a blanket ban on dental amalgam. Do you think that has anything to do with it? Because
so I think there's lots of things, right? So that's a societal issue. But I suppose, we never in the history of the world locked down any country for a flu that had a chance of dying of 1 in 1.82 million, right? So the thing is, what's shocking is, for 50 years, from an economist point of view, that what happens after a lockdown, it was well known, is that you get a huge spike in unemployment, right? And a huge reduction in salary. And some people, like in Switzerland, they said that for 3 months of the lockdown, this is well known, right? That on average, everybody in Switzerland, which is a very wealthy country, would have those exact 3 months would have a reduced life expectancy of 3 months, right? So for every month. And that was well known. But what they said, which was also so when I mean well known for decades in economy, economic journals, social science, is that the loss of life is not evenly distributed. The loss of life in Switzerland was 1 in 50 people who may not have had mental health or would have been exacerbated because of the isolation and the loneliness. And for 1 in 50 people, they would lose a decade of life for 3 months of the lockdown. And that's just around mental health. But of course, with unemployment, people lose jobs. And if you lose your job, you have a 145% chance of having cardiovascular disease and a significant risk of cancer, because you lose money, you're stressed, you don't have. So it turns out that human interaction is really important. So for mental health, you have to get 18 drugs at the minute, right, to have some kind of effect on depression. But of course, if you really wanted to have depression, which is when I'm hoping to retire next year and actually do some real good in the world, is that if you communicate, so I'm saying what we should have a relationship with our doctors to put them on a notice of liability. I know it sounds harsh, but I'm going to try and facilitate this. That if you are a person that you want to be healthy, you don't want to take drugs, and you have an arrangement with your doctor through an app and put them on a notice of liability that they have to give you or recommend the best treatment with the best outcome. So say for depression, it's well known that actually volunteering, joining a community, a choir, can actually prevent a lot of the symptoms of depression. Now, obviously, in some people it won't, but that we need the doctor. So in this case, for the doctor, you could have a record then of, well, did he tell you about nutrition for influenza? Did he tell you that you could do vitamins? Did he give you inhaled steroids? Did he give hydroxychloroquine? And then you or your family would know, wait a minute, the doctor didn't give me. So I think the bond with the doctors is, on a notice of liability, they have to offer you the best treatment. So in Ireland, if you were an elderly person at 95, and when the lockdown happened, you were not given any treatment, you were locked in your room, you got morphine and you didn't get oxygen, you didn't get social contact, you didn't get good food, you didn't get vitamin D, which means you can go out, and you didn't get hydroxychloroquine, that those doctors are not giving you the treatment that's well known. And if you are very sick, or you go from being functioning to maybe have dementia and then you're not functioning, that is like well established. So those doctors, you need to be assessed and said, did you give that person the best treatment? And even what I'm saying is we can forgive them, right? But of course we're now coming into another winter season, and you need to tell everybody in care homes and all people that your doctor has to tell you about this stuff. And if they don't, and you get sick, or if you're the family members, those doctors need to be held to account. And that's, I think that's the kind of relationship, because I think this COVID-19 is undermining the bond that we have, with the medical community.
Excuse me, would you recommend the flu vaccine?
So the thing is, it depends on what's in it, right? It's a bit like, it's like saying, would you recommend a drug? There are hundreds of different vaccines. So in each one, you have to look at the harm benefit. So we'll say there is a vaccine for yellow fever, and in South America, and I have taken a vaccine for yellow fever, because you can look at the profile, and if you find the information, they don't give you readily. There's 1 in 2,000 chance you'll have an issue of brain inflammation, and then if you get that, there's like a 1 in 10 chance you die. So then and then you think, okay, if you get yellow fever, it's quite, So then you make an informed choice. So it's not a blanket thing. It's like saying, would you take a drug? Some drugs are good if you need them, So it's not an answer, but I would be saying that if there is coronavirus in an influenza vaccine, like if they're made on dog kidney, which is known to have these coronaviruses, then there might be an issue with coronavirus circulating. And in the US Army study, 1 in 3 of these healthy soldiers were sick. And in the animal studies for 20 years, the animals were either sick or died. And no one previously had been licensed because of the severe adverse events. So that's your decision then. Because if you have with influenza, if you're nourished, you have vitamin C, D, and zinc, you actually may not get the symptoms, right? You know what I mean? It's not straightforward. It's a harm-benefit analysis, yeah. Sorry,
Do you have a sense of, will there be a mandatory requirement to get these vaccines? Do you sense the medical community and just all?
So part of the thing why I'm speaking out, right, and kind of vocally saying we need to debate these issues, because even Bill Gates said, because they are not testing these in animals, and the reason why they're not testing is because if the animals all die, they can't actually recommend them. But I'm sure you've seen in some of the trials people have had anaphylaxis, Yeah, which is very serious. So even Bill Gates has said the chances would be, I think he said 1%, 1 in 100, right? So that's a harm-benefit analysis, Harm-benefit analysis. So of course I would be saying I've set up the Freedom Party because we are not educated. People don't know that we have unalienable rights, from being human to freedom of speech, freedom of assembly, freedom of thought, and bodily integrity. So actually nobody can, and actually mandatory is not compulsory in law, but there is no basis for it. But of course, if people aren't dying and there's a treatment, if there's not a problem, they're making a problem and trying to find a solution. But if there are other ways to solve that and the problem is not as big as they're saying, then you don't need to be pushing an agenda. So in everything, like a drug, you have to make an informed choice. So if it's histamine and you're not allergic to it and you think it helps you and you talk to your doctor, you take it. You know what I mean? So it's the same with a vaccine. You have to think, well, do I need it? Or is there another way? And then it's a personal choice, but it's all about informed consent. But when the government starts mandating things, right? And even though they know mandatory is not compulsory, and all of these things are regulations and guidelines, and the reason why they are is that I've never worn a mask, and I've never been tested, because I just say to people, there is no legal basis for this. In fact, you're actually infringing on my rights. And if you do have an underlying condition under the guidelines, right, like asthma or an autoimmune disease, you can get a letter exemption from your doctor, and then you are exempt. But if they start saying we need your temperature tracked or whatever in a restaurant, you can say in the guideline, if they don't respect it, you can actually take them under the Disability Act, right? But that's actually at the level of acts and law, whereas I'm saying there's a much higher level that people are not aware of our natural rights, our unalienable rights. And in all of our societies, the government cannot infringe. And that's why I'm going around doing rallies, because I don't know if you saw in Trafalgar, there was no issue and there was hundreds of people in riot gear, right? So what they were doing was infringing on our freedom of speech and freedom of thought, right? It might have looked like they were infringing on our freedom of assembly. But if you can't assemble, you can't actually build your opinion and assess your thoughts, because you don't have the freedom to meet people. And so there is no basis. So what they're doing, also I entirely object that people can't worship. And the state has no power to interfere with how many people come into your home. They have no power to take your children. So, and even what I'm finding, it just sounds very arrogant now, but I don't mean it to be, is that a lot of lawyers and barristers are arguing at a certain level, but actually there's a much higher intrinsic level that because of our humanity we have freedom. So I have set up the Freedom Party, and I'm saying we need to set up freedom parties and potentially have referendums, in November, December on the performance of the government. Or potentially what the governments are doing is they're saying, well, the United Nations and the World Health Organization, we pay a lot of taxes for these non-accountable, non-elected international organizations to do things. And then the governments go, oh, well, and all the restaurants and hotels goes, well, the guidelines, it's not us. And then the governments go, well, the guidelines, it's actually the World Health Organization, right? But when you look at the World Health Organization, there's no real accountability, they're not elected. So really COVID-19 is, showing up society that the politicians want to coast by for 10 or 20 years in a row, not be held accountable, often, bring in policies that are obviously have detrimental impact on society, and then go as if, oh, well, we're doing this because we care about you, when actually they know, and then they set up these scientific committees, by people who tell them what the World Health Organization, and then anyone who has a counter opinion is labeled, to other them. Psychologically there are these buzzwords so that you all think, oh, well, this is okay. And actually subconsciously you all have kind of been primed, as we all have, that hydroxychloroquine must be bad, that anyone like me who does it, I must have an agenda, because we've been labeled. And it isn't really communicated that, like Dr. Adil has been fired, and nurses who are trying to give, correct treatment to people have been fired. And that's not just for people. Now, I haven't been fired yet, but, they're doing their best. Well, they're not actually. They haven't found anything yet that I've said that they can fire me on, but I'm sure any day now. But you know what I mean? So that's not just to us or the 10 people that stand up. The issue is they want to intimidate people who have huge debts. So medical students now, which used to be medical school was free, and nursing was free and hands-on, and they were wonderful nurses. Whereas now the doctors have to pay 10 or 20,000 to go to college, so they have a debt. And when they see someone speaking out, they go, well, that didn't do any good anyway, right? They've lost their job, they've been isolated, they now have lost their career, so I won't speak up. And not only will they're saying not speak up, they'll just say, just wear a mask. Like my doctor said, Dolores, just wear a mask, right? He wouldn't give me the thing until I said, listen, you have to, obviously. You know what I mean? But of course, if you're 70, you wouldn't have, and my doctor's 20 years, you don't want to have that kind of friction. The doctors, if you have asthma or whatever, they should give you those exemptions so you can be exempt, but they're not making it easy. So they have actually reduced the bond, I think. The politicians, the media, and I think once someone calls it out, it's only common sense. Everyone goes, yeah, that's right. So this COVID-19, I saw a sign about 10 days ago that said, it had that Bill Gates's, it was a banner at one of the rallies in Dublin, Bill Gates' photograph, and it said, your plan was to vaccinate the world, with the vaccine. Inadvertently, you've actually woken up the whole world about what's going on. So I think we have to be grateful, and I think COVID-19 is a turning point. And I kind of see the future that it is going to be better, but it actually, what's going on reaches from the United Nations to the EU into the education system, the legal system, the policing system, the media and the healthcare system. And I am not afraid, because we are now building networks in Ireland with lots of other people called the Platform. And I have this building a custodian movement. We'll have like the equivalent of the Department of Food, Department of Banking. And separately in the free market, we'll say, well, if Ireland was working for Irish people, what would food look like? What would health look like? There's a community banking model that Professor Richard Werner does, which is local banking on the German Sparkasse model, and you can actually do innovation. And their message is we want to automate, and everybody will be all not working, and it's a spiral depression, property crisis, it's all terrible. But actually, if you have a different banking system not based on this fiat currency model, you actually don't have to work for 40 years to have a house. It actually doesn't cost that much to renovate a house. You can have a small amount of land where you grow food, you know your neighbours, and you actually spend more time cooking food, bartering food with your neighbours, building communities and preparing food and being time with your family instead of working on this like rat race type thing. And the world, we can also jettison a lot of the debt. This debt is actually fiat, out of nowhere money, right? So a lot of us spend decades of our life paying off money when the banks generated out of nothing, right? So, and there's going to be a huge change in the world, but not the way that they want, that we're all, locked in our homes and mandated by the government, and we're going to be in debt and in poverty and joblessness. There's actually going to be a huge resurgence of people living in communities, working with each other and building up their friends and their family again. So I have huge hope. Yeah, so that's it. Thank you very much.
You remember the swine flu in 2009, and they really scared the people. And all
So I've written, I think that was done from Imperial, right? There's about 6 or 7 cases, and it was actually published in The Spectator. There was an article on it that I got the information, I've checked it out, that all of the time they predicted, like with BSE, avian flu, swine flu, SARS, 500,000 deaths or huge deaths. But in reality, all those deaths were like 200 people, right? 700 people. And so it was exaggerated by tens of thousands. So this is where so SARS in the world and the WHO is 774. But how the magic trick works is people are dying, right? And they only assess and test about 5 or 10 times the amount, right? So say 700 people are dying in the world, and at the beginning they test very few cases. Okay, so say if you tested 10 times, you tested 7,000 people. And then they say they don't acknowledge these viruses circulate the whole world, and they say and publish, and it's still on the website, for SARS, the mortality rate is 10%. The mortality rate, right? And they had the same kind of numbers for this SARS was 3.6. So anyone listening would think out of 100, with SARS, 10 people will die. But no, the magic trick is that they tested 8,000 people and 774 died, right? But they don't mention that that's all that died in like 40 countries and nobody else died. So they call the mortality rates, which scares everybody. But the real thing is called the fatality rate, right? So this is a smoke and mirrors job, right? Because it only works with smoke and mirrors if something is not true. So the fatality rate is the number of people that die in that country or in the world for that period of time, a year, comparison to years before. So when I'm saying, so the fatality rate, the number of people that die in the world for SARS was 1 in 8 million, right? So they're still on the website going, SARS was a mortality rate, right? The same as avian flu, BSE. So they do small numbers, they advertise, that's how the magic trick works, right? Mortality rate 10%, you get a huge scare, you get a vaccine, big frightening, because they're priming people psychologically to be afraid of these viruses. But actually the fatality rate, the number of people that died in the world, which is a common sense thing, it's not related to testing, was 1 in 8 million. So the number of people in Ireland under 65 of this one is 1 in 500,000, but still they're reporting this mortality rate of 3.6%. So it's only when you look into it, it's like an emperor has no clothes, And what's happening now, we have parallel things. That I'm working with Berlin, that they had 1 million people at the end of August. I mean, everybody is. They had 3 million in a rally about 2 or 3 weeks ago. Now, of course, the police came, even though it was really peaceful. But they are saying that 60% of Germany are waking up, right? And the next rally, which everyone is invited to, is in Berlin on the 10th of October. And they're going to camp, all over the centre of Berlin. They're actually going to stay, right? And they want to have 10 million people. So we now have two parallel worlds, and it's a psychological experiment, right? You have the media going on as if the previous story was all consistent, right? It's a killer, you need masks, it's social distancing, the elderly will be locked in their homes, 6 people, right? The government's bringing in policies. But actually, I'm saying you only need one country or two to actually go, no, wait a minute, have an election, bring in people that will go through the data, it will be exposed, and then those doctors and the politicians and their advisors will have to be held to account. And what they're, at some stage, it might take a month, it might take a year, some country will go, wait a minute, there was actually serious issues with fear-mongering, inflating the statistics, the PCR tests are wrong. You just need that to happen in one country, and people like me will go, look, now it's already coming out. So they're still trying to keep us down. They still have hundreds of riot police, antagonizing people that just want to go and listen to nurses and doctors who've got fired for speaking. And then all the media is about, whatever instigated violence, as if we're all conspiracy theorists or whatever. But eventually there will be a tipping point. And partly why I'm so vocal and strident is, and I'm working with, people, lawyers, and we've now got 35 countries, is that if you call out something in May as a crime against humanity, or if you say that people died because it's contributory manslaughter, that people would know. And the crime of malfeasance, which is in the UK, it's 10 years in prison, means that if you're a doctor or a politician or a media person, you can't use the defense, you didn't know. Because if, like Professor Michael Levitt, the Nobel Prize winner, was telling the politicians how to resolve all this in January, and it was well publicized, and there's like 100, doctors, Senator Scott Jensen, all around the world, Judy Bilkovich, Sherry Tempany, that the politicians and the advisors can't say then that they didn't know. And if you cause harm, which is suicide and putting masks on teenagers, isolating the elderly in their rooms, and you should have known, it's a crime of malfeasance in the UK, and it's 10 years in prison. Malfeasance, and it's also misprision, right? But this is 10 years, it's an actual crime, as well as contributory manslaughter. So you could technically say the politicians have contributed to unnecessary and preventable deaths, right? So I'm just saying why we're calling that out. So even the court systems are quite tricky, I will use that. But if you have an international tribunal around the lines of Nuremberg, which we are now working on with, say, Canada, Germany, whatever, that you can actually, in an international law system, hold people to account. And then that is you cannot use the defense, I was only following orders after Nuremberg, right? So if there is criminal, if there are preventable deaths, contributory manslaughter, malfeasance, doctors and politicians and the media and the BBC, reporting things and causing fear actually causes death, right? Causing fear makes people stressed. So just saying there is a level of holding them to account. And in Germany, if 60% of the population know that there's no basis for it, if there is an election, that is a good country. So they want 10 million people coming out on the 10th of October in Berlin. The whole world is invited. And then, they could call for an election. And they're going to camp out until they either end all the lockdown measures or they're going to try and move the society. So this thing will fall apart. Yeah. Now, there was a quick question there, and then I do have to go.
This is very important. I don't know if it would be
Oh, no.
possible
Yeah.
to get you to speak to my community or to translate this and put it across our people.
Well, I mean, it's been recorded, so you could always put on subtitles or whatever, Now, I'm just going to I'm actually meeting a member of Parliament, so I'm just going to text him that I'm a little bit late. And there was another question. Yeah.
Could you repeat that word?
It's called malfeasance, M-A-L-F-A, malfeasance, F.
But can I use this word to
Yeah, you can, if you search malfeasance, yeah.
argue my sister being in lockdown?
So I'm actually informing people and barristers, you will end up having to get a solicitor or a barrister to do that. So there was another question at the back, if that's okay? Was there another question?
Hi, yeah, can I get into the question, but instead of malfeasance, isn't it actually crimes against humanity, which is the very highest crime?
Yeah, but that's more difficult. You see, that's on an international court, which takes years, whereas malfeasance is a crime in the UK. So the thing is, we don't obviously want to be putting doctors and politicians, ideally. So why I came out stridently in May to say that is, a bit like when you hold coroners, you remind them of their legal duty. And doctors, if they put on something false, if you remind someone what you're doing is a crime, they also know that it's a crime, right? Because we obviously were copying the letters to all over the place, right? You know, writing to people, copying people. So you can't say you didn't know, and everybody knows. So then they go, oh my God, then I better look back and say, well, was it Alzheimer's? And if it was, I better go and correct it before it's officially reported. So part of the thing of calling these things crimes would be that the politicians, because really if I was in London, I would be getting thousands of people to do a recall on a minister, right? Just one minister, right? And then holding them to account. Or set up a party and say, if you guys don't end the lockdown, we're going to have a freedom party, just a pop-up party. You know, or to have a referendum on the lockdown in November, right? You are the power and we're paying their salaries. So if the members of parliament thought, oh my God, I'm not going to get elected, it's not so cozy now in this world where if 60% of Germany are calling it out, you know, or if the Canadian Prime Minister has been, you know, going to go to court because they, you know, it was disproportionate, right? So, I mean, people, you need to take charge. We're paying their salaries. You know, we're paying their taxes. They're not working in our best interest. So you have to. So while I agree with the International Court, that's going to take years. Whereas malfeasance is a crime. And actually, if you have an elderly relative, you can actually write to your doctor and say, COVID-19, what did you prescribe under freedom of information or whatever, right? You know, you can actually get that health information. Or if you have an elderly person, you can get their permission to ask for what they were on over the lockdown and if they had symptoms that were not properly treated. So that's illegal. I'm not a lawyer or whatever, but I mean, partly what we're trying to do, you know, obviously I'm not trying to dismiss it, but you need to then use your network or go to, like, if there's Age Action or some community or here and, you know, come together. You guys have power. You're very intelligent people, right? You know, there are lots of ways to do it because you can challenge the care home worker and say, what is the basis? When you know it's more harmful for the elderly to be isolated. And young people will not give them any disease, so there's no need for masks. And it's all harm benefit. The masks, in my opinion, cause more harm than good.
If you want to take them out now, if it's relatively won't let you at all.
No, you have to challenge it, right? So, of course, it's a bit like saying, oh, you know, we have 17,000. You don't have to say they won't let you, right? That's not how it works. You have to say to the government, you've got 1,700 people here who's actually writing these things, and if you do something wrong, you have to be held to account. So part of the thing that we want to inspire in people is that, you know, we have all these inalienable rights, and if someone is infringing on your that's their freedom of movement, right? You know what they're infringing on is no matter whether you're 90 or 100, you have freedom to assemble, you have freedom to walk out. You're not a prisoner. And so if the basis of the lockdown is wrong, right, if the data doesn't support it, and the elderly are harmed more by being isolated and not getting hugs, then you say to the care home worker, you provide the evidence that actually isolating my elderly relative is doing them more good. And if you can't, then say the elderly person, right? They are, you know, no matter what age you are, they can say, I want to go and see my family. And they could say, I'm leaving now. I'm going to go for Sunday dinner. You know, we have to take personal responsibility, right? And if they want to leave, then the care home worker may call the police, they may call the doctor, they may want it sectioned. And then you say to the care home worker, I'm going to hold you to account. Show me the basis. And you might end up, unfortunately, in court. Nobody wants to. And then the care home worker, you might win. You are welcome to get my number. I am ringing up schools. You know, I am available to we just need 1 or 2 cases. So, I mean, if I was 70 in an old folks home and looked at the data, I'd be saying I'm going for Sunday lunch, right? Okay? And then it's like, you know, or I'm going to move a care home that will actually do a harm-benefit analysis and only implement policies that are... So that's the government, right? So they've had it very easy. And, of course, they had it very easy because they're using all the organs of state against us, right? We're paying for them, and they've got the police in riot gear, even though everyone is going, wait a minute, what are you doing, right? So, of course, we have to then push back. And how you do that is use the democratic process, you use the legal process, you use your voice, you educate yourself, and you get somebody like me. There are lots of people now speaking out. Now I have to go, I think. That's all right. I think... So the thing is, right, guys, I'm afraid we're all adults. This lovely lady here is saying she's been told she can't go, right? So, of course, I go, right? I fly. No one says anything to me. I'm not well known, right? I'm not well known. And it's not like they know me. So I don't really want to be known. But then in the airports, right, I just smile at everyone. Every single person when I went to Edinburgh was all masked, right? On the plane, no one said anything to me, right? And you know why they don't say anything to you? It's because they know you have freedom of movement. You have freedom, you have bodily integrity. So they didn't even have to ask me. These are all guidelines. You are consenting to not leaving your care home. These are only... No, you weren't made. You weren't. Yeah, but you know what? If someone said, you killed someone, you'd say, no, excuse me, I'm not following orders, right? So you just have to... I'm always very polite. I just say, no, I'm not. Like temperature, I haven't got my temperature done, right? You just say... Because your health information, that your temperature is private health information, right? But obviously you have inalienable rights of bodily integrity. So someone forcing you to put on a mask is actually an invasion of your privacy. And I think that the three things I think the mask, and this is just me, I haven't heard it, is that they want to psychologically damage the next generation. They want to undermine the societal bond because people become more afraid. Yeah. They want to make, well, whether they want to make people sick or not, they are more harm. But also it allows, when you see the police and people interacting with you, they're not identifiable. Right? Which is a huge issue. So what I was thinking is that the mask should actually be, of the police, should be the same as their face, you know, so that we can identify them. Yeah, and the same thing when the doctors were detaining me in the airport, two of them had masks, and I said, you know, they were obviously going to arrest me or whatever. So I said to them, what's your number, your name? Well, you know, they had masks on, like of two of the three, and they said, oh no, GDPR. Do you know the General Data Protection Regulation? I said, unfortunately, I'm an expert in that too. Bad, not your lucky day. So I said, you know, if you're a policeman arresting me with the mask on, you can't pull the I'm not going to give you the thing, right? You know what I mean? Absolutely. I will sue you personally for false arrest, right? You know, and of course I told them we have inalienable rights and there's no requirement to sign the form. And of course they didn't detain me, right? So you can't just say, just because someone tells you to wear a mask or that you can't fly or you can't leave a care home, you guys, everyone in the world, right? The education system, the media, we've all been dumbed down, okay? So we actually do need a little court, but you guys might have more time than me, about inalienable rights, and that we are sovereign people, and no one can, you can only do something by consent. The masks and the guidelines and staying in homes is only by consent. And what they want to do is they're artificially making this thing a big problem, that you have to wear masks and do things that you don't like, and then the solution is potentially multiple vaccines or multiple testing. But the thing in China, what they use the testing for is, right, why you don't get tested or you don't sign those forms is, once you sign the form to get tested, you're actually waiving all of your rights that they don't tell you. So, of course, I wouldn't sign the passenger locator form because on the the print it says you can't leave the country in 14 days. And once you do that once, you've waived, well, you don't, obviously we will get them back, but you're waiving your rights. Once you put on a mask, you're actually waiving a lot of your rights. Once you get tested, they can use your data, but your data. So, of course, if you were a big data analytics company, and you got everybody's data, especially children, you can psychologically profile them for the next 100 years, right? So you can then learn from them that whether who's going to get depression, what do they watch, right? So it's a huge invasion, the data of your bodily integrity, and your data is private, and your temperature is private, and no one can be taking your temperature, and nobody who's not a nurse, because why they're taking it is that the government in a year or two, they want the next generation to think this is normal, right? That the government can track you. And of course, the beauty is if you're speaking out as a police person or a teacher or an ordinary person, suddenly your temperature is going to be high all the time and you'll be stuck in your home and you won't be able to travel. So easy peasy. Welcome to China, right? So we have to, so part of why I'm saying we need freedom parties is that we are sovereign people. We have inalienable rights. We are lucky to be alive. It's a beautiful world. we don't need all this police, we don't need all these agencies, we need to eat well, we need to look after our health, we need to be kind to each other, we need to volunteer, we need to practice our religion, and we need to join choirs, and we need to give something back. Yeah, and it's a beautiful world, and we're lucky to be alive. I have
two friends who were at the protest on Saturday, and they witnessed, they were quite traumatised by very severe police brutality.
So everything was fine until 4:30, right? Absolutely blissful, right? And then hundreds of police came in riot gear. So just, you know what I mean? We don't need to. The important thing is, and everybody there were saying to the police, there was no issue, right? No alcohol. Everyone. So the police. So it's all videoed on Rupley and everything. And of course, we will be reporting it, right?
What can people do if they witnessed very severe police brutality?
Well, they can email me at dolorescahill@gmail.com, because we obviously will be complaining to the police, right? Now, I'm saying I'm trying to focus on COVID-19, so I won't be doing it, but we are, like, there were barristers volunteering and solicitors on the day to protect us because they were threatening to arrest us. Yeah, I have to go now. So there are 54 COVID vaccines. It's a bit like, you can't just say, you know what I mean? There's 54 vaccines. Yeah. But of course, it's a bit like chickenpox, right? Just think of the analogy of chickenpox. That's where we are, right? If you're still alive, COVID-19 circulated, we're alive, we're immune.
Can you repeat your investigation, please?
Yes.
I heard somewhere, in one particular article, that actually, for this sort of virus, you can't make a vaccine, that it's all fake.
Well, no, that's what I'm saying is you can always make a vaccine. It's a commercial product, right? Like you can make a car, you can make ice cream, you can make cheese. What I'm saying is, over 20 years, when they put similar RNA, vaccines to RNA viruses, that the side effects in the animals were so bad they either all got sick or they died. And they were not licensed. So there were plenty RNA vaccines made to coronaviruses, right? But they weren't licensed because there was so much death in the animals. And there was one paper from 2012 where they did RSV, respiratory virus, and they gave it, even though the animal studies gave ill health, they gave it to 35 babies, and a lot of them went to hospital and 2 babies died. Okay, but from the animal studies, it was known that was going to. So of course, that virus might kill 1 in a million or something. So you have to do a harm-benefit analysis, and 2 babies dying out of 35 is way more harm, and some of them were sick than the benefit. So that was then stopped and not recommended. So yeah, it's not like there are 54 companies trying to have a product. So if the government mandates a vaccine, they will have a huge market because people think if the government recommends it, it must be okay, and then maybe 1 in 10 people won't take it. But of course the issue is, if there's huge deaths or illnesses next year, right, that we will have set up already. We don't want people to die, but we'll be pointing to the politicians and the ministers for health and say, wait a minute, these people are dying from the side effects of viral interference or immune priming, and you should have known because these things were not tested. And the other thing they shouldn't do is, if they are going to give these vaccines and people were taking them, they should be monitoring their adverse events. And if 10,000 people get it, they should be looking and seeing, are the nurses not feeling well, which they generally don't do very well. Adverse event reporting. Now I have to go because I'm meeting a member of Parliament.